Hello, welcome back or welcome new, whichever you happen to be. This is Little Wins and I am Tony, and I have Parkinson's disease with cervical dystonia and REM sleep disorder. So today I wanted to talk about cervical dystonia. I've had some people ask me about it. And give me just 1 second to say props to myself. In some videos, I look very haggard and tired. And maybe you think that way about how I look right now. But I actually feel like I look better than I have. And it's probably because I've had some more time outside and a little bit more movement the last several days. So that might have helped me. Anyway, to me, that's a little win if I can see myself not looking as drugged down tired. So, that being said, well, let's talk about cervical dystonia. I've had seen comments and had some comments about nobody's talking about dystonia. Now, I can tell you my experience and what I understand, but I can't tell you everything because I'm still learning myself. Okay, so I have cervical dystonia, cervical being the neck, which was really confusing for us for a few minutes because, you know, women have 2 cervical areas of the body that I never really realized until it never clicked in my brain. But anyways, I have cervical dystonia. So my head has a tilt that you can see. I can straighten it up. It hurts to straighten and hold it up. And it feels like my whole head is going to rip off this side. So it stays left to feel better. I have the dystonia really tightens up the muscles. The muscles in my neck are like I have rocks in my neck, and they feel just as heavy as if I had a huge baked potato sized rock on each side of my neck and in the back of my neck. Now, it affects my range of motion. I can turn my head to this far, but then a lot of pain comes and it shoots the pain down my spine, and I turn it this way and it is even worse, pulling here up through my neck, and it shoots pain down my side. I can force my neck a little further, but it hurts a lot. Now, I do exercises to stretch my neck. When I can bend my neck forward, that's not a problem. Back is not a problem, but it hurts to put my head forward and back, but it doesn't hurt like side to side hurts. So there's that. I have an issue in my legs. So my doctor did some CAT scans and MRIs checking my cervical spine to see if there was something in my cervical spine causing the issues in my legs. The issues in my legs are the right outside hip and down to my knee. The right side of that leg will go numb. I can't feel it, except for sometimes a tingle and a pain, but I feel the tingle coming on and then the numbness starts. The other issue I have from it is my legs are very weak, much like if you have the flu and you're running a fever. My legs feel like that all the time, but then they start to get really heavy and the numbness comes, and that means that I've been up too much, and there has been a couple of times that my legs have just completely collapsed out from underneath me, and I've just fallen straight down because my legs just decide they cannot stand up anymore. Now, after the cervical spine CAT scan and MRI, there was nothing found, no crushing on the spinal cords or anything, or on the nerves to cause that to happen to my legs. So he was looking for a medical reason for that to happen. A disc slipped or something is out of place, right, for that to happen. But there's not. And, you know, when they put you on the table, if you have Parkinson's, you know, or MS, and they push your legs down, and I can't hold my leg up while he pushes against my leg. I just can't do it. And I can't do a very good weight amount at PT. It's really, leg pushing is, you know, 30 pounds. So more than that, it gets really too heavy to just push with both legs 30 pounds on the table. And I have to fight to get my legs to work for a stationary bike. I have to fight for that. Even at 5 minutes, my legs, they're done. So when he did these tests, he found nothing that was causing my legs to do that. And up on more examination, he discovered that it is the pain that radiates from my neck down through my tremor. So this dystonia is cervical dystonia, but it travels to the trunk, which mine has traveled to the trunk and along the spine. And that pain that I have from my neck into my hips is what fatigues my legs so much, is fighting against that pain that comes from the dystonia, that very tightening muscles, and I just can't get them moving. Now, I do stretches and exercises, and my doctor put Botox in my neck, and I'm 6 weeks into it. I've talked about the Botox before. Now I'm 6 weeks into the Botox, where he did one shot on this side in the front muscles, but not on this side, because he didn't want to affect my ability to swallow. And he put one in the back here and 2 back here. So we did 100 mils on that, and I maybe wrongfully assumed that it would help my tremor, but it hasn't helped my tremor. But it has helped some pain. I do feel less pain. Everything is still like a rock, but I do have less pain in my neck, which is very good. I do take periods of time during the day where I lay down to rest my neck so that it's not the weight of it constantly going, you know, being a bobblehead all day long, your neck, muscles, everything, and it just gets so tired, and it travels all the way down your body. So I do have to lay down and rest my neck a couple of times, and I also nap during those couple of times. That's how I make it through the day. It takes me a couple of naps a day. I think the pain is exhausting. I think the fact that my head never stops moving and that it's going down my trunk, because I literally feel it in my stomach, and I wonder if I can trimmer my way into cute little abs one day. We'll see, right? But I feel it moving down my body in that way, and it's exhausting. So I have to lay down and I have to try to rest those muscles a little bit so that they can be able to stand up again. I've learned the signs with my legs where I might feel like I could collapse, and I don't push further. When I start to feel it, I sit down. I have a walker, so if I was to use the walker, then I could sit on it. It is the rollator. If I happen to be in a store, I might sit on the soda pallet that is short enough to sit on top of the soda. Wherever I have to sit down or whatever I have to do at that moment, I sit down because it's a lot less dangerous than falling down. Now, what I know from cervical dystonia is it can eventually lock your muscle into place, and I believe all dystonias can do that, and they can travel, and those muscles just get locked eventually into place, which doesn't sound fun. That's something that I'm still learning about. So I will try to figure out if that is a reality. I'm going to do more research. You can do some research on that as well. There are exercises you can do. I have exercises from my therapist. They suggested to try massage, but they're not sure that massage will even work, and I haven't paid to do that. So I do have a massage wand for it. It sometimes helps and it sometimes doesn't. At the end of the day, it's just, you know, another layer to the Parkinson's journey. And if you're suffering from dystonia, it hurts. You know, there's 100%, it hurts. You have tremors with a muscle cramp, but your muscle won't stop cramping and you won't stop tremoring. So imagine like my neck is like a foot. When, you know, we've all waken up with a Charlie horse in our foot or a cramp in our foot. That is the pain that will go through my neck often, pretty much daily. You know, the Botox, we started at 100 mils, so perhaps he can up the dose and inject more muscles, and it will help. I don't have Botox again until July, so we will have to wait and see for a couple of more months. And you never know, the Botox is just now at its peak time period, so it may go ahead and work. Now, another issue I've had, which does not feel like a tremor, it feels muscle, is my eyes. My eyes feel like they want to close. My eyelids feel very heavy. So I am curious to find out if this is a Parkinson's symptom or a dystonia in facial muscles. But I've noticed that for about the last, Well, several weeks when my YouTube is fairly new. So in my videos, I find that my eyes are closed when I'm talking, or I find my drawing up my eyebrows to hold my eyes open. So that is on my list for the doctor for the next visit, to find out why my eyelids are suddenly so weighted and don't want to stay open. I mean, the eyelid itself is skin, I guess, right? But the Parkinson's affects the muscles, right? And the muscles tremor, but the dystonia affects the muscles, and there are muscles that open and close your eyes. So I don't know. It's something I have to find out about. But I will keep posting as I learn about dystonia. For the people who aren't hearing enough about it, I'm not an expert, but I will keep posting, and you can ask questions, and I will keep researching and see what I find. I will tell you there is a TikToker named Parky, P-A-R-K-Y, Larry, L-A-R-R-Y. He's on TikTok, and he discusses his dystonia in his leg and his medications. I'm less than a year into my diagnosis, but he is several years into his diagnosis, so he may be able to give you more information. I will try to link that in the description, but I'm not sure 100% how to link it, but I will do my best. I'll at least put his name in the description so you can look on TikTok for him. But he does have good information and exercise that he does for his dystonia that's in his legs. I will make a video showing you exercise that I do for the dystonia in my neck. And how I try to keep my neck loose every day. I will give you that information as well. This is my little girl Opal. But I will give you that information as well to help with that. And if you have questions about anything, or there's anything I can help you with, please leave it in the comments. Don't forget to give a thumbs up to the video and subscribe for more information. And if you know somebody who needs help with a positive little win lifestyle, knowing that even with things, medical things that happen to us with a chronic illness, we can find little ways to win in life, and things can be better. Thank you for taking the time to spend with me today. I really appreciate it. Opal wants to say hello. She gets missed not being here to see everybody. Anyways, thank you for everything. Have a wonderful day.